Continuous positive airway pressure, or CPAP, is the delivery of slight positive pressure similar to blowing through a straw to prevent airway collapse, reduce the work of breathing, and improve alveolar ventilation. With CPAP, positive pressure is exerted throughout the airway during the entire respiratory cycle. It is a tool that has been gaining attention and popularity within the EMS community following positive results of several documented studies.
Once the decision has been made that you're going to put CPAP on your patient, these are the steps that you need to follow to deploy the unit. First, you need a CPAP generator. You need a 50 psi gas supply so that you can connect your oxygen tank to the generator. You take the 50 psi DISS female fitting and connect it to the generator. Make sure that it's tight so that none of the oxygen leaks by. Take the other end, connect it to your 50 psi outlet on your regulator. Make sure that it's tight as well. Don't turn the oxygen on until you're ready to deploy the unit onto the patient, or you're going to lose some of your oxygen and it's not going to last as long. Next thing you need to do is to set up the patient breathing circuit. This is the proximal end, and it needs to be hooked up to the CPAP generator. Take your flanges, push it in like that. Tighten it, make sure that it's secure. Make sure that this is turned off. Take the patient connecting part and hook the mask up to it. Make sure that everything's snug and that the valve is sitting the way it's supposed to. The medium-sized mask will fit about 80% of your patients. You want to make sure that you keep the head strap handy so that when you're ready to secure this to the patient, that you haven't lost it or left it behind. Another option that you have to protect you in the ambulance is to put the bacterial filter on the exhalation port of the CPAP machine. If your patient's condition dictates that they need a nebulizer, you also have the option to put a nebulizer in line with the CPAP generator. Prior to putting this into the circuit, put your medication into the nebulizer cup and then hook this up to an oxygen source at 6 to 8 liters a minute. Break the patient circuit from the mask, plug the SVN in like that, and then plug it in as so. At this time, you have the nebulizer running, and the patient will get the medication with the CPAP mask. Hi, Mr. Jones. I'm Randy. I'm a paramedic with the fire department here. Okay. The EMTs were concerned because they put you on a non-rebreather mask, and it didn't seem to get your respiratory distress to go away. All right, I know you're short of breath, so I'm going to ask you a few questions. Okay. But I don't want you to talk too much because I just want you to concentrate on breathing. Okay. They informed me that you have congestive heart failure and that it's progressively gotten worse over the last couple days. You're to the point where you can't stand it anymore, and it's created a little bit of discomfort in your chest. You feel like you're drowning? Okay, good. Well, we're going to get some vital signs on you, even though the EMTs did. We're trained a little bit differently, and then I got some things that we can do to make you feel better, all right? They also told me that you take Lasix, 40 milligrams a day. Okay. All right? So what we're going to do is worry about getting your breathing fixed, and then we'll take care of some of those other issues you have. So I want to listen to your lungs, okay? All right, great. Yeah, your oxygen saturation's low, but I think we can take care of that, okay? I need you to lean forward for me. Go easy. I'll help you. Another couple seconds. Just hang in there. All right. Go ahead and lean back, Mr. Jones. All right. You got crackles halfway up your chest. Your congestive heart failure is causing that, okay? And it's called pulmonary edema. In other words, there's a little bit of that, got so much fluid in there, it's kind of leaking into your lungs and making you feel like you're drowning. I can give you what's called mass CPAP, but I need you to help with it. I need your cooperation. It's going to feel like a lot of air is being forced into your airway, like it would feel like you'd put your head out the window going 50 miles an hour. All right, it's going to take me about a minute to set it up, and then I'm going to need your assistance, okay? All right.
We got 218 over 110.
Okay.
I'm going to put them on the monitor.
Okay.
Now lift your shirt up and put some patches on your chest. This won't hurt.
I'm going to put this right here. Have you ever had a tube put down in your trachea to help you breathe? Yeah. Okay. Have you ever had CPAP? Looks like this before. Yeah. You go ahead and hold that for me, buddy, all right? Give me a second. You're not going to be able to do it with this on there, okay? It's going to alarm, but everything's okay. Hands are free. What I want you to do is I'm going to take this off, and then you're going to put this and hold this against your face and get a good seal, okay? So let's take that off.
Here's some light fetal pulses.
Okay. You go ahead and hold it on there, Mr. Jones. Go ahead.
2 hands.
Yeah.
Good.
All right.
Hold it nice
While
and
you're holding it on there, I'm going to turn it up, and you're going to feel more flow go in there. All right? Do you feel that? Okay, let me turn the mask off. All right, Mr. Jones, I'm titrating this up, turning it up so you're going to feel more flow. You're going to feel more back pressure when you're breathing. But it's going to fill your lungs up with more air and oxygen. It's going to make it easier for you to breathe. Okay, you got to trust me. Just stay relaxed, okay? How you doing? Is it helping? Okay. It's going to get up a little bit more. Our goal, Sandy, is to get up about 10. All right, do you trust Andy to hold that mask on so I can put the pulse oximeter back on you? Okay, so I can monitor what's going on. I got it. Go ahead and put your hands down. If you feel nauseous or you feel like you can't catch your breath while you're on here, you need to tell me right away, okay? Good. I need to listen to your lungs again, and we're going to get another blood pressure, okay? As soon as we do that, we're going to go to the hospital and get you there, all right? Yes. Okay, lean forward for me. There you go. Deep breath. There you go. Go ahead and lean back. Good job. You're doing great.
208 over 100.
Pulse oximetry is 94 and it's been coming up. Let's get you to the hospital, all right? We'll do the rest of everything else en route.